Assalamu alaikum. Hi everyone. Hope you're all keeping well. Moving forward with our lectures on the International Patient Safety Goals, I'm going to do the next two lectures in the form of this video presentation, which I think as well would be better because taking into consideration the current situation with the pandemic. Inshallah, when things get better, we can move back to having the lectures in the radiology conference room. Okay, so thus far we've done 3 of the goals. We've done patient identification, we've done clinical handover communication, we've done fall prevention and management. All right, so the next 2 goals, the 4th one, which we'll do now, is verbal and or telephone orders, and the 5th goal is critical results of diagnostic tests. All right, so just want to mention the 4th and the 5th goal that we will do now is part of effective communication, okay, which the JCIA they focus on this because they've done studies where it was said that a lot of medical errors happen because of communication, and so they've come about with these goals to improve patient safety. Okay, now with verbal telephone orders and also like with the 5th goal on the reporting of critical results, okay, these goals, they directly impact or mainly impact the doctors, the physicians, and a registered nurse. Okay, so okay, let's move forward on the goals of the policy. All right. So, what are the goals of the policy? As with all the other goals that we've discussed so far, is what they want to do is they want to standardize all the processes that we are following. Okay, so for the verbal telephone orders, they want to standardize and provide a framework for the safe practice of verbal orders in our center. All right, so they want to minimize the risk of errors resulting from misinterpreted verbal orders. Okay, so keep it in mind, this can happen. There can be errors that will arise during verbal orders being given, like, for example, like, errors can arise from the way, just from pronunciation or different dialects. Also, like if the audio is being given in a background that's noisy and the receiver may not hear properly, and might take down something incorrectly. So, yeah, keep in mind these things are likely to happen. All right, and to ensure that effective communication and continuity of care. So, these are the definitions of a verbal order. It is an order given by the physician verbally during an emergency to support the immediate needs of the patient. Okay? And a telephone order is an order given by an authorized physician in response to a nurse initiated phone call. So, like I said, maybe we'd not see these things too much down here in radiology, okay? I mean, but yeah, it's likely to happen in the ward where a nurse is dealing with a patient and suddenly the patient's condition starts deteriorating and the physician is not on site or, not around. So she needs to call the doctor to act immediately, and doctor gives a verbal order through the telephone. Verbal orders will happen definitely, and it can happen only in radio, during a code. Okay, if a code happens and nobody has the time to go in a computer and document an order, all right, so orders will be given verbally. So there's like 2 situations where you're likely to see verbal orders being given. All right, so the question arises, is it allowed here as per our policy in our center to give verbal orders? And the answer to that is no. Okay? Remember, it is not allowed to give phone orders even when the physician is physically not able to make the order in the S. Okay, so remember this one. And what they say in the policy and note is a physician will be available in the center at all times. Okay, so going on to the next one, next question is, when are verbal orders permitted? Okay, so when will you allow to, when is it allowed for a verbal order to be given? All right, and this is what you have to remember is here, as per the policy, it is only going to be under emergency circumstances. All right, not in any other instances. So what are the emergency circumstances? All right, so these are circumstances that refer to a medical crisis that arises suddenly that compromises the patient's condition, such as an acute change in the patient's vital signs or status that would result in rapid deterioration if not treated immediately. Okay? An acute change in the patient's behavior that has the potential to threaten the welfare of the specific patient or other patients or the staff as well. Okay? And also the circumstance, an unanticipated or sudden occasion as an emergency surgery needed to prevent death or serious disability. And also during a sterile procedure where it is difficult to document an order. So next question we come is, who can give the verbal order? Okay, and that is only a licensed physician. Okay, they can give the verbal order. That is when they are physically not able to enter their own order. All right, so it's only the doctor who can give the verbal order. And then, by whom who will be the receiver of these orders, or who can receive a verbal order? All right. So as per the policy, they say it is only by another physician. All right. It can only be from another or a registered nurse. Okay. So even though it doesn't impact other clinical staff, or say, for example, here in radiology, like for the radiographers, even though they'll never be taking a verbal orders, we still need to know these processes and how they work and what happens. Yeah, we have to know, right? Okay, so the next question to ask is, what conditions that verbal orders should not be given for? Now, verbal orders is mainly concerning cases where, it's going to involve like medication, yeah, all right, so the administering of medication, okay, so that's what it's mainly all about. Okay, so these are the cases where the verbal orders for these types of medications, you'll not be able to give a verbal order. Yeah, cytotoxic agents, I think, is chemotherapy drugs. Okay, and there's high alert medications, there's narcotic medications. So this is mainly nursing, and yeah, but it's good to know anyway. So next question that arises is, what is the process that must be followed during verbal order? Okay, right. So says that the completed order must be clearly communicated. So doctor will be giving the order verbally, and the receiver is going to listen and confirm, read back to the doctor and confirm, and doctor is going to confirm it, okay? And then it's going to be documented in the hospital information system, right? So now, when medication orders are being given, so this is the process they're going to follow, is you're going to document the name of the medication, the dosage, okay, dictated in words, as they say, like 20 milligrams with 2 zeros or something, yeah? And the route and the frequency, okay, example, 1 tablet orally, stat, okay? So very clear, precise documentation. So the receiver have to repeat back the order to the prescribing physician and confirm the individual giving the order. All right. So this is the process that is followed. Okay, and what then happen is the physician later on, as soon as like whatever emergent situation is happening and it's resolved, then the physician goes back and makes the entry on the system. So normally I think it has to be done as soon as possible or max within 24 hours. Okay, so, and that's it. And that's a recap of the patient identifiers. All right, so when should you check for patient identifiers? And that is every time you interact with the patient. And that's a very short lecture on verbal telephone orders. Okay, and so I hope you're like happy with this video presentation, which is nice because you have access to it. You can listen to it whenever you want at your own pace, and and we're communicating these. This will be communicated via Otman Shema through emails. You'll get it in the groups. So I think in this way, there's no chance of it not reaching anyone. Okay, even when you're on leave, you have WhatsApp, and you have access to your emails. So yeah, guys, that's it for this one. Yeah, and then now I'm going to follow with the next lecture as well, which is going to impact in radiology, our radiologists with the reporting of critical findings. Thank you very much, guys. Thanks. Bye.